Hello everyone, I am Dr. Somalika and I am practicing as a Senior Consultant Neonatologist and Paediatrician at Cloudnine Hospital, Kailash Colony, New Delhi. So in our daily office practice, oftentimes new parents, especially young mothers and young fathers, they are very apprehensive about certain physical findings they may see in their baby, which you would commonly hear your pediatrician say, oh, this is nothing, this will probably recede. So I am here to discuss today about such common findings and which should be a concern for you to take your child to a pediatrician and which would probably something that you can wait at home and wait for it to subside. So commonly right after birth, in the first 24 to 48 hours, especially if your child has undergone a vaginal delivery, there might be something like a swelling on the scalp. This swelling is usually soft and boggy and commonly called a caput or a Caput succedaneum. This is like a soft tissue swelling due to the birthing process and would usually recede completely by 24 to 48 hours of life. If the swelling is persisting beyond that or is looking very well defined and is increasing over time, you should definitely see your pediatrician with such a swelling. Sometimes children would have reddish spots which resemble blood spots in the white of the eye. This is commonly called a subconjunctival hemorrhage. Again, it's a common finding seen especially in babies who are born out of vaginal delivery. These would resolve completely by themselves between days 7 to 14 of life. Occasionally, children on their face or their body or their back would develop reddish spots which can look like a small red dot surrounded by a reddish area of erythema on the skin, and they may actually seem to increase starting around day 2 to day 3 of life, especially well-born term babies, and would gradually increase over time up till day 7 to 10 and gradually recede thereafter. So these are Erythema toxicum. These are normal newborn rashes and you would not need to worry about them. However, if the rashes are looking like frank blisters or they have whitish collection within them, or if the rashes are staying beyond the prescribed 7 to 10 days of life, on your follow-up visits, if your doctor has any concern, then you should of course see a pediatrician because of them. Occasionally children will have this whitish pearly dots on their nose, which again is Milia. It's a normal finding seen in plenty of children and nothing to worry about. Sometimes parents would notice a small whitish dot on the tip of the penis of male children, or would notice some pearly white dots on the hard palate inside the mouth. These are Epstein's pearls and they again are absolutely normal physiological findings and you don't need to worry about them. Babies would sometimes have breast enlargement at birth and some babies may even actually exude some milky-like substances. No expression or no handling or manipulation of the breast area should be done. It can actually be harmful, and these are all due to the effects of maternal hormones and would subsequently settle by the next few days, usually 7 to 10 days or 14 days of life. Female children similarly due to maternal hormones can have vaginal discharges, white discharge, or even occasionally vaginal bleeding. Again, not a cause for concern. You should keep the area clean and not tamper too much with it. And over time, this will settle by 7 to 14 days of life. The umbilical cord right after birth is healing and drying up, and the cord would probably dry and fall off in the first 7 to 10 days of life. There can occasionally be some colorless discharge right at the time of separation, and if it does not persist or there is no redness or no foul smelling discharge, one doesn't need to worry about it. Again, in male babies, the foreskin appears very close to the tip of the penis and no attempt should be made to withdraw or try and recede the skin forcefully. This physiological phimosis is a normal finding in male babies and is not usually a cause for worry or concern. So these are some of the findings that are commonly seen on the baby's skin or physical appearance, and in case it is bothering you, you may talk to your pediatrician, but they are usually commonly observed normal neonatal findings. Thank you so much.